Welcome to the NAHA webinar brought to you by the National Association for Holistic Aromatherapy. To learn more about NAHA, please visit www.naha.org. Tonight's presentation topic is Children and Essential Oils, a look into the ins and outs of safe use with children. This educational webinar is being presented by Duncan. Amber is a clinical aromatherapist and she specializes in the teaching of safe use of essential oils with pregnancy and children. Amber is a NAHA regional director and a contributing author for the NAHA Aromatherapy Journal. She was also a speaker at the NAHA World of Aromatherapy Beyond Aromatics 2016 conference. To learn more about Amber, please visit her website at www.theapothecaryinstitute.com. And I'd like to take a moment and welcome Amber for tonight's webinar and appreciate you being here. You can go ahead and get started, Amber.
Awesome. Thank you so much, Kelly, for having me on today. Again, my name is Amber Duncan. I am a clinical aromatherapist, and I do specialize with pregnancy and children. These are areas that are very near and dear to me as I have been pregnant most of my aromatherapy career or had very young children. My children are currently 6, 4, and 1, so I am very into using safely with them. I also, earlier this year, had the ability to speak at the SOFT conference, and SOFT is the support organization for trisomies 18, 13, and related disorders. So this organization asked me to come out and speak about general safety and use of essential oils with children, because so many of the issues that their kids that they work with come across, parents are looking for more natural options. The kids are on a lot of prescriptions oftentimes, so they hear a lot about how essential oils can help. So they asked if somebody would come out and speak about general safety and how to use with children. So if you want to learn more about them, or if you have a friend who has somebody with any of these disorders, you can visit trisomy.org. And the conference this year was in Tacoma, Washington, and I believe it's set for Wisconsin next year. So what we will cover tonight, we will do a brief introduction to essential oils. We will cover the safe use of essential oils with children. We'll go over basic general safety along with age group specific recommendations. Next, we will go over studies to review. I have 4 studies here on slides to review with you guys. And then we have other natural ways to enhance immunity. With the nature of the season and the craziness happening with the weather, enhancing general immunity becomes very important, especially when working with children when their immune systems haven't had a chance to fully develop. Helping to enhance that development really can do a lot as far as keeping them well this time of year. We will also go over recipe ideas for winter. This will include colds, allergies, fevers, and cleaning recommendations. So, introduction. To get us started, we will cover some basics of what essential oils are and the basics of the different ways people use them. So what are essential oils? Well, they are the volatile compounds found within plant material. And volatile in this instance just means they easily disperse into the air. We know that many of our top notes, our citrus oils, release very easy into the air, whereas our more base notes and things that are found in roots or resins tend to evaporate more slowly. But we do know that they do evaporate into the air. So if you were to open your bottle of essential oil in the middle of the room, they would begin to evaporate and you would smell that throughout the area. The plant is put through a man-made process. This is very important to note because to get the sheer amount of essential oil that we do, it has to be processed in some way. There are 2 ways two main ways this happens, either through steam distillation, which is how most essential oils bought in stores will be processed, or cold pressing. You see a lot of citrus oils from this process to get the most essential oils from the rind of the fruit. It is worth noting that steam distilled citrus oils do not carry the same phototoxicity necessarily that the cold pressed oils do. So if you're looking for a scent with less phototoxicity in a citrus, you will want to look for a steam distilled as opposed to a cold pressed essential oil. So what is created is a very potent mix of chemicals, and it can have therapeutic effects. By can have, we mean that the effects can often vary from person to person. We know that there are generalized effects that we see across the board, but the extent that those effects will affect you can change and vary. This variables include age, health status, and even the mentality going into the use of the essential oils. So, ways to use essential oils. There are many different ways to use essential oils, and here are just a few that we will go over. Topically, dosing will be dependent on age, and we will obviously go more into age-dependent dosing here shortly. Lotions can be bought. You can buy a great lotion at your store, preferably unscented, since your plan is to add a therapeutic scent to it. So it's very good just to find a really great, that works well with your skin, lotion that is unscented. Salves, these are very easy to make yourself. You can combine things like beeswax, jojoba, shea butter, and get an amazing salve that can help with different skin conditions or cuts, abrasions, and you don't necessarily even have to use essential oils with those salves. I'll go over a little bit of that in a minute with concerns with diaper rash and how you can help with that. There are many great recipes available online. Many of the great schools approved by NAHA have amazing recipes for creating balms and salves and everything like that. So it's definitely something to look into. Roller applicators, these usually come in a 10 milliliter size, but that can vary depending on how you buy them. And all you're going to need is a drop or two of your essential oil, depending on age-appropriate dosing, of course, and the rest will be filled with a carrier like jojoba oil or fractionated coconut oil. Inhalation. There are a couple of different ways to inhale your essential oils. Diffusers, there are many different subtypes, and usage will vary based on age and the type of diffuser used. Ultrasonic diffusers are your diffusers that have water in them. Nebulizing diffusers, you plug the bottle of essential oil straight in, and it puts off a very, very concentrated dosing of the essential oil. There are also fan diffusers where you place the oils on a pad and then a little fan blows over it to get the essential oils to go into the air. You can also use aroma inhalers for inhalation use of essential oils. These are a great way, especially when working with kids, to be able to control how much they use it, and they can be personalized for each child that you have or even for yourself. You can easily label them. There's normally a cotton wick inside, and you can even go through and buy completely organic cotton wicks if that is something you are interested in, and the scent can last upwards of 6 months on an aroma inhaler, depending on which essential oils you use and how much you use. Ingestion. This is something that really needs to be covered with somebody really well qualified, and it's not something that should be done casually. If you're looking to use via ingestion, please seek out somebody that is well trained in aromatic medicine so that you can make sure that what you are doing is safe and for a very safe amount of time. Safe use with children. So what we're going to cover next is age-specific recommendations, but we will start with basic guidelines for safe use. These age recommendations are going to include oils to avoid, dermal recommendations, and diffuser use recommendations. So basic safety. Again, ingesting should never be done casually and should only be done under the guidance of someone trained in aromatic medicine. This is just a very, very safe way to make sure you're doing it correctly. Essential oils should not be used in the bath water. Since oils and water do not mix, it is never safe to just put them in the water. Chances are you're going to end up with some sort of a burn if your skin comes into contact with the essential oil. So you need to use an emulsifier when you go to use essential oils in water. It's also very important to keep them out of reach. There's many ways that you can do this, and you go with what's best for your household. You can put them with the rest of your household chemicals that you don't want the kiddos getting into, or you can even consider putting them on the top shelf of the refrigerator. Remember that many essential oils are better stored in the refrigerator anyhow, so this allows them to then be out of reach for the children. You can buy child-proof, child-resistant caps if your bottles don't already have them on, which is an amazing way to update your essential oils to be safe for your kids and make it a little bit more difficult for them to get into the bottles. Oftentimes when a poisoning happens, it's because a child got a hold of a bottle and tried to drink it. So it's best to make sure those child-resistant caps are on. So we recommend no use in the nose because it is a very sensitive mucous membrane. So this, includes putting the bottle right next to their nose, which would be a strong essential oil vapor, and we don't want to burn that sensitive mucous membrane. And so the vapors can be too strong even with adults, so it is best to not have the child smell the straight bottle. Make sure it's away from their face, or use something like their aroma inhaler or a diffuser as opposed to trying to have them smell straight out of the bottle. So these next two slides are essential oils to avoid with children under the age of 2. I know you are all perfectly capable of reading this list, but there are a few I kind of want to point out, kind of pull out so you guys can get a better understanding. First, I want to note that you will see 3 different recommendations next to the common and Latin name of these oils. Avoid using via any route means just that. We don't want to use this essential oil at all because of the risks that it poses with the child. Avoiding topical use, so this would be no topical or dermal applications. It is worth noting, before I pull one out, that clove bud is on here as avoid topical use. So when you're recommended to put clove oil straight on the gums of a teething baby, you probably shouldn't. I recommend doing that to yourself first and seeing how it feels if you're really interested, but we really don't want to be applying neat oils to the gum line because it is, once again, a very sensitive area. So applying neat, not only is topical use not recommended with clove in general, but we also don't want to use that neat use on a sensitive area like that. You also will see avoid using near or directly on the face, and this is just because of the oils being too strong. The vapors just, kind of overwhelming the child and the concerns with that. So a couple of the oils I want to emphasize. Anise, which is actually the first on the list, is one that I have seen used in what are supposed to be kid-safe blends for tummy issues. Now, you see on this that is recommended for avoid using via any route. So this is because it can be a blood platelet aggregate inhibitor. So basically it can slow the ability to stop bleeding. Now, with young children, they're always running, they're always bumping, bruises happen, you look at them and go, where did you get that? I know it happens with my kids all the time. Shins get scratched up. And so what we don't want to do is have them using an essential oil that can slow their ability to stop bleeding. We don't want that bleeding to continue. We do want the body to do its job and clot efficiently. So we do not want to use oils that can slow that ability, like anise. Birch is listed here to avoid via any route, since it too can inhibit blood clotting. Clove bud, as I mentioned, is often seen in many blends to kick bugs, especially this time of year. You always see it listed in blends recommended, to kill everything in the air, but so it can help with some of that, but it's not recommended for topical use. So applying it to your child should not be done, especially with this age group. Eucalyptus is avoid using near or directly on the face. So you can still use your eucalyptus around little ones. I know that Tisserand recently updated his recommendations with this one, that children under the age of 3, you can diffuse or apply topically up to 0.5%, and from 3 to 6 you can diffuse or apply topically up to 1%. But this is still not using near or directly on the face. Depending on the age of your child, even their feet can be near their face if you really think about it, because of just how small they are. So it's something to be aware of. Lemongrass is also here and is often touted for its use with repelling bugs. Again, this one is just a non-topical recommendation, so you can apply it to their clothes in a spray or around them. It can help with the bugs that way, but applying it topically to their skin is something that we should try to avoid. So on this one, I'm just going to pull out a couple. Oregano is a very hot oil, and as such should not be used on the skin. If you can, avoid it. And then the tea tree listed here, I want to make sure you guys see that it is a lemon-scented tea tree. This is a completely different plant than the normal Melaleuca alternifolia that we see for cleaning and for other generalized use. This is a completely different tea tree, so you're still able to use your Melaleuca alternifolia with kiddos. It's just not recommended to use the lemon-scented tea tree. So, ages 2 and under. Yes, this is a picture of my oldest back when she was my only. She was our surprise, and boy, she threw us for a loop. But she's adorable, and we love her, and she's now got her own little anxiety issues. So if you guys ever need help with anxiety type issues, we can go over some of the things we're doing in our own home for that. But specifically working with this age group right now, under the age of 3 months, the recommendation is no direct essential oil use. So this just means that you don't want to be applying topically to the child. You don't want to have them right next to a diffuser. If you need to apply to yourself before you hold the baby, make sure you do it a little bit before you hold the baby. You don't want to be doing it. You don't want to be applying directly to breast tissue if you're breastfeeding, because the baby's face is going to be right there. That's something that I cover with my pregnancy and essential oils information. So after the age of 3 months, then the body systems are a little bit less sensitive. They're still very, very sensitive, but they're a little bit less than the newborns. So diffusers use, you want it on for 15 minutes prior to the child's arrival, and then turn it off once they are in there. Basically, we just don't want to saturate the air that the kid is in before they enter the area. We just want a light amount of the essential oil, because really that's all they need. Essential oils really truly are a less is more type of application. Topical use is 0.25%, 0.25%, with a maximum of 0.5%. So very, very low dilution. If you were to make a blend for them in like a roller ball, you'd actually need to make it in a larger container, because it's very hard to get half of a drop of an essential oil or less. So the best essential oils around this age are TLC. Tea tree, your Melaleuca alternifolia, lavender, your Lavandula angustifolia, and Roman chamomile, or chamomile comma Roman, if you're looking at the TLC. So yes, that is what you want. TLC, tea tree, lavender, and Roman chamomile. I do want to bring up, next up, yes, so, sorry, I apologize for that. I do want to bring up teething, since teething tends to happen a lot in this age group. That 2 and under is when they're getting their first teeth. And again, I see clove recommended a lot, but obviously it's recommended to avoid topical use under the age of 2, so we wouldn't want to be applying that because of the burn, and just that it's really not recommended for the sensitive gums. So what things can you do? You can use hydrosols, and hydrosols are the waters left over after steam distillation. Many hydrosol distillers actually distill straight for the hydrosol, not so much for the essential oil, because creating your essential oils and your hydrosols is kind of like creating a fine wine. There's very specific recommendations for temperature and time that go into it. So when you want to make a really great hydrosol, the time might not be the same as you would in a steam distillation for the essential oil. So they tend to kind of go hand in hand, but kind of not. So for teething, great hydrosol is chamomile. And this is awesome because it can apply topically to the outside of the jawline. You don't have to apply it inside the mouth. You can literally just rub it on the outside. Oftentimes hydrosols come in a little spray bottle, so you could spray it onto your own hands first and then apply, and it really helps to bring down just that inflammation and that pain associated with the teeth erupting through the gums. You can also use a washcloth in regular old water and get it cold, like in the refrigerator, and allow the child to chew on that. There's no essential oils, not even a hydrosol. You can really just use water, and that gives them that cooling effect on their gum line, and it just really helps with the teething. And because when you think about how big those teeth are coming through their little gums, it cannot be comfortable at all. So helping them with giving them something to chew on or applying a hydrosol topically is a great way to go. This is also an awesome time to throw in a little bit of information about diaper rash. There are many great carriers to use for diaper rash because you don't even need to use essential oils necessarily with these carriers. So I do not recommend coconut oil, which I see a lot of recommendations about, because it can tend to trap heat, and that can actually make things worse when you're talking about a diaper rash. So a couple of carriers I recommend are Tamanu, which is a great anti-inflammatory and analgesic carrier oil. It's green, so it looks a little funny, but it does it great, and you can pour it into a roller ball and apply it that way, or just apply with your hand or even a rag. Another one is jojoba. This is most like your body's natural sebum, so it is a great option when using to try and help heal up their skin with a diaper rash. Next up is ages 2 to 5. This age group is really for me right now, since my 4 and almost 2-year-old. Woo! We're getting through the terrible 2s slowly. They will be over hopefully soon. But the oils that you see here on this list are very similar to the ones from the under 2. It's just shortened a bit because the body systems are more adapting to the world and the earth that we live on, and this includes their skin. It's a little bit tougher at this point, and we also have better ideas of what their allergies may be, or if they have any other asthma or medical conditions that we need to be aware of. So when you know those medical conditions, you're able to then make sure that the essential oils you use are safe for that condition. So that is something very much so to be aware of, and just keep an eye out if you need to actually speak with an aromatherapist. That's a great way to do it, to make sure the oils that you're using with your small child are perfectly safe. This is also a time when a lot of kids are in preschool, and I know that a lot of preschools right now are diffusing essential oils to try and help with that bug concern, all the germs that float that kids spread with their fun wiping noses everywhere. Fun. Because most of the people coming into a classroom very, very frequently, it is very hard to really be aware of what everybody has and if they have an allergy or if they have an asthma situation. So we'll go over this a little bit more in a moment, but there are a lot of concerns with the germ blends and how they're used. So be very careful. I would not recommend use in schools because you just don't know everybody's potential sensitivities with allergies and their asthma and what it can be triggered by. So it is very difficult to really diffuse in a classroom without risking. And above all, do no harm if we always have the ability. So, ages 2 to 5, diffuser use. As you can see, diffuser use is 30 minutes on, 1 hour off situation. This makes it very easy if you can get one with a timer on it already, or if you use like a plug-in wall timer, then you can have it set to turn back off. I know that there are many out there now that do have the timers on them, so it makes it a lot easier. Topical use for this age group is 0.5% to a maximum of 1%. So that's kind of 5 to 6 drops in an ounce of carrier is about 1%. So that's something to be aware of when you're creating blends for this age group. Great oils to use. There's 12 here: lavender, Roman chamomile, sweet orange, bergamot, cedarwood, frankincense, geranium, ginger, lemon, sweet marjoram, tea tree, and thyme. Next up is the ages 5 to 10. With all my kids heading that way, because they always just seem to keep on getting older, I look forward to the changes in the therapeutic items that I can make to help them and their friends, because it's coming. They always just get older every day. Turn around. They're not the same as they were. So here we have just 3 oils. The ones concerned here are wintergreen and birch because of their ability to inhibit blood clotting, and they can also be toxic to the reproductive system. So we just don't want to use those. And again, eucalyptus still is for avoiding that near directly on the face, which would include the chest area. So if you're creating a, Vicks type of blend, it's better to not use it directly on the immediate chest, but lower down, like around their lungs or on their back, if you're going to use eucalyptus in this situation. So, with the lowered oils to watch also comes different dosage recommendations, closer to that of adults. Since the body systems are maturing and the skin has become more prepared for its duties as we change throughout life, we can change up the recommendations. Diffuser is still recommended for 30 minutes on, 1 hour off, and you'll see that this is really the recommendation for all of adulthood as well. It just is a good way to make sure that we're not oversaturating the air with the essential oils. Dilution recommendation here is 1 to 2%. So if you're applying to the face, like if you are starting to create a face moisturizer or something to help with beginning to erupt acne, if they are actually encountering that at 10, then I would still recommend starting off at like 0.5%, or if it's something strong like tea tree, maybe even only 0.25% on the face, just because the skin on the face is much more sensitive still. And so you want to see how the skin responds before upping or changing the dosage. So, ages 10 through puberty. The only essential oil that here we want to watch is the use of chaste tree due to hormone modulation. With those ever so precious and precarious preteen hormones, we don't really want to be messing with them too much, just because preteens are fun enough on their own. Why add more hormone craziness? So the dilution recommendation here is 1% to a 3% maximum, which is anywhere from 5 to 15 drops of essential oil per ounce of carrier used. Diffuser use is again that same 30 minutes on, 1 hour off situation. With the dosage for dilution and skin application, remember, it is always best to start low. Start at the 1%, work your way up if you really need to. It is very easy to increase the dose, but what you can't do is take away a skin sensitivity that has developed from overuse or even borderline abuse of an essential oil to a too high level. So now we're going to go over a few, four, studies that show us some of what has been studied as to the effects of essential oils with children. So this first study up was performed in Cape Town, South Africa, and it showed us that with 71 pediatric burn patients, a therapeutic massage decreased the heart rate, decreased the respiratory rate, and the conclusion was that aromatherapy massage did help the stress level of the children. In the full study, it was noted that a review of 24 randomized controlled trials showed that single and multiple massage sessions did reduce anxiety, which is amazing to hear. So also noted, there was a study on 178 patients, all undergoing stem cell transplant, that did not show a reduced stress effect from humor therapy, massage, or relaxation imagery. The oils used in this particular study, this study number 1 here, were lavender, angustifolia, German chamomile, and neroli. This blend was in a 1% dilution in grapeseed oil because, and I am quoting from the study here, essential oils cannot be used directly on the skin in their pure forms. Essential oils in their undiluted form can cause skin irritations, photosensitivity, or allergic reactions. Love it. I'm glad they noted that there in the study. It's a very nice thing to see. So up next is this second study. And here the study was conducted in 2013, and it found that lavender did reduce postoperative pain medication needs, which is amazing. It was given in inhaled form, so it ended up that the patients did still sometimes wake during the night, which is to be expected. They would do the same thing for pain meds in the middle of the night. Once that effect wears off, they need more. So the same effect was then seen with the essential oil of lavender. In this third study, you can see that it was a para-anesthesia study, so it was for patients undergoing or recovering from anesthesia, and they used lavender and ginger to help with the kids and their nausea. So there was 2 groups, 94 kids. One received a group placebo, the other one received the actual aromatherapy use. So we also noticed that they demonstrated lower distress levels, which is awesome. I know that lavender is great. We know that lavender is great for a lot of people's for stress issues. We do know that some people react to it a little differently and it can hype them up, which is something to be aware of with kids, that lavender might not have that really sedating, sedative kind of effect. It can hype them up kind of like using Benadryl. Some kids, it sends them to sleep. And then you have other kids like mine who it just sends them running around. Case in point, when we were traveling to Japan the first time with our then 18-month-old daughter, like we weren't stressed out enough with moving, across an ocean, we thought, okay, we'll try Benadryl to see if that helps her relax, because the flight is literally 14 hours for just the one leg. So, of course, our child was the one who didn't fall asleep on that 14-hour flight. She did crash out after that and end up with pink eye because of all the other kids running around that aircraft. But it's good to know that and be aware that lavender doesn't necessarily always calm down children. It can send it the other way. Same thing with adults. There are some adults that don't react the same way and the sedative way to lavender. And then ginger, we know, is awesome for nausea. It's my highly recommended one in pregnancy and for anything post-op for the nausea use, because it tends to work really well, and then you don't have to worry about any effects and things being too strong, like peppermint. Peppermint can, I find it too strong when I'm already kind of nauseous. So ginger tends to work better, and I've seen it with the different people that I have worked with. This last one, I want to share another little quote from the study because it's so much fun. So aromatherapy is a valuable means of maintaining an optimum health, particularly when the disease of the body or mind is related to stress. So Janice mentioned this and I found that amazing and something really fun to think about, because scent just plays such an important role in how our brain works, because it's all just interconnected. So we know that the smelling of things can really calm us down and can help bring us out of a stressful situation. So that's a really cool little quote. This research outlines key areas that may be causing stress in the child in this hospitalization with HIV. areas that they pointed out were separation from the parents. Oftentimes when a child is staying in a hospital, the parent cannot stay with them 24/7. It's just not possible. So the kids can be forcibly held for procedures that have to be happening. So this can increase their stress and anxiety levels. Also, they're being awakened from sleep when they're hanging out in the hospital 24 hours a day. Just as if anybody's been in the hospital and had to stay, the nurses come in at all hours to go, hey, here's your meds, or hey, we need to check your blood pressure, which they're just doing their jobs, yes, but it definitely affects your ability to sleep, which then can affect your stress levels. So in her review, she mentions that the following essential oils may be best for use with children in this type of a situation. Lavender, of course, Roman chamomile, neroli, mandarin, sandalwood, palmarosa, and geranium. So, other ways to enhance immunity. Many times aromatherapy is reached for to try and cure something happening within the body. Fixing something after it is broken is not always the best approach. Instead, we really should try to keep ourselves healthy through our foods, our herbs, exercising, yes, definitely. It's something we all need to work on, I'm sure. So this approach, keeping it healthy, helps our bodies to stay strong and to eliminate the need to fix a problem that has already occurred. So first up with this, vitamins. Great vitamins for well care, as I so deem it, include beta-carotene, vitamin C, vitamin E, zinc, and selenium. Now, foods with these vitamins are listed here, and this is a way that in their foods is really the best way that they're bioavailable for you. However, you can also go and get a really high quality vitamin, but please make sure that you get good directions on the best way to take it. Oftentimes it's with a certain meal or with milk, or just there's different rules to really help the vitamins within that become truly bioavailable and for your cells to actually be able to uptake them. So it's something very important to be aware of when you're starting new vitamins or a new routine of any sort, is to really just make sure you're doing it the best way possible for you. So herbs, I found these recommendations on for dosage on a WebMD, which was very impressive to me, as too often people head to WebMD, input their symptoms, and it just tells them everything they could be possibly dying from. So it was fun to see a really herbal approach to some common things, and these are ones that they've seen in research and actually show a good response from. So for elderberry, it listed as possibly effective for flu, helping to reduce the length of the time of the flu lasts when taken by mouth within 24 to 48 hours of the first symptoms. For echinacea, they note that it used to be listed within the National Formulary from 1916 to 1950, but then it kind of fell out of preference with the invention of antibiotics. And now that we are encountering all these lovely resistant to antibiotic strains, it is making a resurgence, and people are looking again to the herbs and the natural ways to use food and everything around us to really help us stay healthy. It is also worth noting that echinacea lab research is suggesting that it can stimulate the body's immune system, though no formal research has shown this effect in people. So next up, recipes to aid the winter. Yay! I know we all love recipes. So we're going to go over 4 different areas: fevers, colds, allergies, and cleaning. Fever essential oils. So what you want to look for when you go to search for fever essential oils are febrifuge. What this means is that they help to dispel or reduce a fever. Some essential oils that have this capability are black pepper, Roman chamomile, eucalyptus, nagarmatha, palmarosa, peppermint, pimento berry, and spearmint. Now, when working with little ones, obviously you want to work with the essential oils that are safe for them. So in that 3+ month mark, you really only want to work with probably the Roman chamomile to try and help. You can also then move into like your spearmints and really just start with the lighter stuff, the more gentle essential oils. As you smell them, they tend to be just kind of refreshing, and then work up to kind of your sharper ones like your black pepper or your peppermint. So recipes for fevers. A great idea is to create a cooling compress. So you can do this by adding 2 drops of a cooling essential oil, like the ones listed above, to 1 quart of water. So like I said, I like to use Roman chamomile because I find it just to be a very gentle approach to helping out kiddos. So you want to swish that around in the quart of water and get the washcloth soaked. Wring it out so that no water is dripping, and then you can apply it to the forehead, the back of the neck, the underarms, even the feet, just to help cool them off. Since the head and the feet are where your body loves to disperse all of that lovely heat, it's really good to wipe those areas down with something cool. If you need to, go back, re-wet it and reuse it. That way you can help get everything off. You can even use a new washcloth each time if you're really concerned about germs being on that washcloth that you just used. Essential oils for colds. Here, the essential oils that you really want to look for are anti-infectious, which can include also antibacterial, antiviral. You also want to look at expectorants and decongestants. The difference is how much it's trying to get it either out of the lungs or out of the head. So essential oils that have these types of therapeutic properties include angelica root, Douglas fir, eucalyptus, larch, palo santo, and ravensara. Ravensara is high in 1,8-cineol, so once again, that's one that you do want to keep away from the nose and the face, even the chest area of the younger children. So, recipes for colds. Here's a great way to create a diffuser master blend, and you can combine the following essential oils or ones that you really find to work well for your family into a glass container. You can buy the 5 milliliter glass dropper bottles, and then you're able to apply the dropper, and you can just go around your house if you have multiple diffusers when you're turning them on to apply straight from the dropper. In this recommendation, it's 10 drops of Douglas fir, 10 drops of hoe wood, 10 drops of juniper berry, and 10 drops of tea tree. Now, I personally love hoe wood. It's one that I feel like every parent should have in their go-to essential oils. Because hoe wood is very immune supportive, it can be sedative depending on who it works with. It's one of those, I haven't found it to be very sedative for my kids, but that doesn't mean that my friends haven't seen it work for theirs, because they have. So it's lavender all over again. But hoe wood, it's just, you get the smell, and it's got that very woody, very comforting scent to it. So it's an awesome go-to, great for lungs and allergies and colds, and it's an amazing oil. If you haven't had the chance to grab some, I would go at least grab a sample from somewhere, because it really is a fun oil to have on hand. I also love juniper berry, but that's just me. I love the scent of it. I don't know if anybody has smelled juniper berry before, but it's, once again, it's got that really refreshing, light scent to it. So for this type of blend, when you create a master blend, what you're going to do is add the appropriate number of drops to your diffuser. And obviously you can follow the age recommendations for the use of your diffuser. So if it's only supposed to be on for 15 minutes before the baby enters, so do that. If it's supposed to be on for 30 minutes on, hour off, you can go with that. Allergy essential oils. Man, lately, allergies just kicking up kind of everywhere. I think there's just something with the world going on. So essential oils that can help with allergies include blue tansy, German chamomile, Grindelia inula, Rosalina, linaloe berry, and Siberian fir. For allergies, my favorite use with my kiddos is Siberian fir. It works the best for my family. It is one of the firs, so it's safe for the younger kids. I use it mainly with my 4-year-old. Right now, he's the one who seems to have the most allergy issues, though the baby seems to be catching up. His nose has been running non-stop for most of the past couple of months, but I've tried to avoid using essential oils for my kids until they get to about 2. It's just how I feel comfortable for my family. I know it's not necessary, it's just, comfort levels. So Siberian fir is what I use with my 4-year-old to help his allergies. He was born, along with my almost 2-year-old, in Okinawa, Japan, and that is a island in the middle of the Pacific, and it's fabulous, but it doesn't really have a lot of evergreens because it doesn't really need them. It always stays warm, so they don't really grow there. There's a lot of palm trees and other tropical type of plants, even though it is a subtropical area, and it never really gets below 50 there. So when we moved back to Ohio, which is where we are now, these allergies kind of picked up and just blossomed out of nowhere. And so I found that a inhaler with Siberian fir, a little bit of hoe wood, once again I just love pulling that out, and a drop of German chamomile has helped a lot. I do vary that up on occasion, and I'll throw in different oils here and there because I don't like my kids to become used to any one type of blend. So normally every couple of months I change up his inhaler, and I always let him kind of be there and help. I'm using air quotes with the help there because I don't want him obviously using the essential oils. I don't want him that comfortable with them coming out of the dropper, but I do want him to be aware of what I'm doing and how it can help him. So we go over a lot of the science and the chemistry and that fun to just kind of enhance their learning into the holistic side. So an allergy recipe here to Blanket Aroma Inhaler: 6 drops of Siberian fir, 6 drops Rosalina, 3 drops of blue tansy, and 3 of German chamomile. This will really help out with a lot of the kiddos' allergies issues. Cleaning essential oils. We love to clean, and we love it when our houses smell pretty. Of course, mine never seems to right now, but that's 3 kids, 3 dogs, and a cat. So essential oils that what you want to look for in your essential oils when you're cleaning. Anti-infectious, which again, antibacterial, antiviral. So essential oils like that are bergamot, cistus, elemi, eucalyptus, lemon, niaouli, ponderosa pine, sorrow, tea tree, or thyme. These are all great that cover that anti-infectious, antibacterial, antiviral. A recommendation for cleaning here for bathroom surfaces is a 16-ounce spray bottle, 7 ounces of water, but you can use your hydrosols here, which is awesome because that helps give that extra layer of a scent and possible therapeutic effects. So then 7 ounces of distilled vinegar, 10 drops of bergamot, 10 drops of tea tree, shake to mix, and enjoy the bright scent. I do want to make sure we kind of point out that cleaning with the essential oils is awesome, but you also need to check what type of counters you have, because I know that granite counters using lemon definitely can actually eat through that top layer of sealant, creating making the porous surface underneath it more available, and then you possibly ruin the pretty granite. And when you spend that kind of money on countertops, you don't want to ruin it with that. So in that case, if you have a granite countertop, really just using your Dawn and your really simple cleaners is really the way to go. But if you have your cheap counters like I do, you can use your essential oils because it's not going to eat through that surface. So here I have references that you have found throughout this webinar, and specifically slide related, so that you can go back to the exact slide and find the exact item referenced. So to learn more, obviously, please go to naha.org. There's a lot of amazing, amazing information there. And you can also find me online 2 ways. Facebook, which is Holistic Health Helper LLC. Yes, I know it's a tongue twister, but I love it nonetheless. And my website is the Apothecary Institute. I have also started a safe use of essential oils for parents Facebook group, which is another great way to start learning more. And if you need information or a link to that, please just contact me via either my Facebook or my website. Miss Kelly?
Excellent. Thank you so much, Amber. That was a really wonderful webinar. I know a lot of people are going to benefit from all this great information on how to use essential oils with their children. So we really appreciate it. So thank you.
Thank you very much. You have a beautiful evening.
Thank you.